Hello, my name's Bridget Dorr, and I'm going to be performing my health assessment on Kate. Prior to the patient entering the room, I had her empty of her bladder and change into a gown. I took her vital signs, her height and weight, and the near vision was tested with the Rosenbaum chart. So I'm checking Kate's head. I'm going to go into the head and face. It's upright and still, negative for any tics. Her scalp is rounded. It's normal cephalic and symmetrical throughout. Her eyes and ears are symmetrical. Her skin is clear and intact. In the skull, I'm going to palpate. There's no depressions, no masses. It's symmetric and smooth. There's no nits, no scaling, and her hair is evenly distributed throughout. There's no alopecia, and the follicles do not fall out. I'm going to palpate her facial bones and palpate her sinuses. I'm going to palpate the maxillary and the facial bones here. I'm checking for any tenderness. Are you feeling any tenderness?
No.
I'm going to have her, I'm going to palpate the temporomandibular joint. I'm going to have her open or close her mouth. Move her jaw from side to side. And I don't feel any popping or clicking when I'm doing this, or pain. I'm going to check her cranial nerves. I'm assessing for symmetry. I'm going to have you wrinkle your forehead, close your eyes, clench your teeth, smile, puff out your cheeks, and stick out your tongue for me. Okay, great. Next, I'm going to check the trigeminal nerve, and this is going to be discriminate between light sensation. Now you close your eyes. Can you feel that?
Yes. Yes. Yes.
All right, very good. Now I'm looking at her eyes. I'm making sure they're symmetrical. I'm looking at the eyebrows. The hair is equally distributed throughout, and it extends past the temporal canthus. I'm checking her orbitals and periorbital areas. They're free of any redness, any swelling. In her eyelids, there's no eye drooping or ptosis. She can close her eyes completely, negative for any tremors, redness, or flakiness, and no tenderness or nodules. I'm checking her eyelashes and her eyes. They curve away from the eye globe. Her irises are hazel. Her pupils are equal and round, and the conjunctiva is pink. Her sclera is nice and white. I'm going to palpate the lacrimal apparatus. I'm checking for any tearing or exudate, and none is present. Now I'm going to perform the, I'm going to check her peripheral vision, and I'm going to do the confrontation test.
Yes. Yes.
Yes, okay. And I'm going to check with the pen light, direct and consensual pupillary responses. Direct, consensual, direct, and consensual. And those are present. I'm going to check the 6 cardinal fields of gaze with my finger. Now you follow my finger with your eyes. And that's present. I'm going to check for strabismus. I'm going to have you cover your right eye. Now cover your left eye. And no strabismus is present. I'm looking at the ears. The auricles line up with the outer canthus. Her ears are symmetrical. Her skin is normal in color. There's no deformities, no lesions present, no nodules or discharge. I'm going to palpate her auricles. They're firm, non-tender. Are you experiencing any pain when I'm doing this? Okay. And then with my otoscope, I'm going to look in her ear. I'm going to make sure I pull it. I'm going to pull her ear up and back. I'm looking inside. I'm looking at the tympanic membrane. It appears pearly and gray, and the light reflex is present. I'm going to perform the whisper test. Maverick, you cover your right ear. Orange.
Orange.
Cover your left ear. Apple. Now I'm going to perform the Weber test. You hear that? Yes. And now I'm going to test the Renee test. And put this on her mastoid process. Okay. Okay, all right. And the air conduction is greater than bone. I'm checking her nose. It's midline, it's symmetrical. It's good in color. I'm gonna palpate. And then I'm gonna, her nares appear oval shaped, symmetrical. There's no flaring. I'm gonna have you close one of your nostrils. I'm checking for patency. And close your other nostril. All right. And I am gonna have you look in your nose. I'm looking to see the nostrils, and her nasal mucosa appears glistening and pink. The turbinates are good in color. There's no swelling. Her septum is midline, and there's no perforations or bleeding present. Next, I'm going to check her mouth and pharynx. Her lips, they appear pink and smooth. There's no lesions or cracks. And I'm going to check with the tongue blade in her mouth. Her mouth looks pink. It's red, it's smooth. Her gums there's no inflammation. Can I have you smile? She has 32 white ivory teeth. And open your mouth for me. And both the floors of her mouth, there's no lesions present. Could you please stick out your tongue? I'm gonna look at her tongue. It appears dull. It's red and moist. It's midline. There's no tremors present. It's the ventral side, the frenulum is present, and it appears smooth and pink. Now, if you tilt your head back, the hard and soft palate is present, and it's continuous with the hard palate. And the uvula is midline. Checking to see if the tonsils, there's no apparent swelling. Her anterior and posterior pillars are intact. The posterior pharynx is smooth and glistening. There's no mouth odor. Now if you stick out your tongue and say ah, and her gag reflex is present. Next, I'm looking at her neck. It's symmetrical and symmetrical musculature. Her skin is smooth and intact. There's no masses or swelling, no obvious jugular venous distension or prominence of the carotid arteries. I'm going to check her active range of motion. Can you please turn your head from side to side? Up and down. And then I'm going to have you try to turn your head towards me, please. And then I'm going to have you shrug your shoulders. Now I'm going to palpate the carotid pulses. I'm going to do that one at a time. I'm going to palpate the trachea. Have you swallow as I do this. And it's midline. This thyroid is smooth. I'm going to check her lymph nodes. I'm going to check the occipital, the periauricular, postauricular, tonsillar, submandibular, submental, the superficial cervical chain, the posterior cervical chain. Have you turn your head? I'm checking the deep cervical. Turn your head to the other side. And the deep cervical on that side. And then the supraclavicular, and no nodes are present. Next, I'm going to auscultate. I'm going to auscultate the carotid with the bell of my stethoscope. Go ahead and take a deep breath. Good, and let it out. And take a deep breath and hold it. Great, let it out. And I'm going to auscultate the thyroid. How to take a deep breath. And I don't hear any bruise. Next, I'm going to check her upper extremities. So they're equal in size and length, and the muscle mass is even. I'm going to check her skin. It's warm, dry, and intact. There's no lesions or swelling. Her nail beds are clean pink, no clubbing. Her capillary refill is less than 3 seconds. Her nail plates are hard and smooth, and the nail base is firm. I'm going to check her radial and brachial pulses. Starting with the radial. Her brachial. They're both strong on both sides and even. Now, Kate, can you please turn around for me? I'm going to look at her back. Appears warm and dry and intact. Her back is symmetrical. There's no obvious skeletal deformities. Her cervical and lumbar spine are concave, and the thoracic area is convex. And the AP diameter, as you can see, is less than the lateral diameter. I'm going to palpate. I'm palpating the costovertebral angles, and then I'm going to percuss down her back. I'm going to percuss the costovertebral angles. Now I'm going to inspect her respirations. They should be even, no obvious trouble, shortness of breath, and her respirations are symmetrical on both sides. They rise and fall, and her breathing effort is unlabored and within normal limits. I'm going to palpate for thoracic expansion. Can I have you take a deep breath? This is along the level of the 10th rib, and it's equal. And then I'm going to palpate for tactile frontitis. I'm going to have you say 99 for me.
99, 99, 99, 99.
Okay? And I'm going to have you lean forward just a little bit for me. I'm going to check for diaphragmatic excursion. I'm going to have you take a deep breath and hold it. And I'm going to percuss along the scapular line. So I'm checking for resonance to dullness. Now I want you to take a breath out. And I'm going to percuss up. And her diaphragmatic exertion is 4 centimeters. Normal is 3 to 5, so she's within normal limits. I'm just going to auscultate her lung field starting with posterior. Take a deep breath. Deep breath. Take a deep breath. Again. All right, great, thank you. And while I'm going to listen to her heart now, if I could have you turn around. So I'm checking the aorta, the pulmonic, Erb's point, tricuspid, and mitral area. And I can hear S1 and S2. They are clear. She has no extra heart sounds. Now, if I could have you lay on your back for me, I'm going to check her abdomen. So her abdomen looks flat. There's no protrusions or pulsations. If I could have you lift your head for me, Kate. There's no signs of an umbilical hernia. The skin is intact. There's no lesions, rashes, or scars. Her umbilicus is midline. I'm going to listen to bowel sounds in all 4 quadrants. And bowel sounds are present in all 4 quadrants. Now I'm going to auscultate her abdominal, aortic, her renal, her iliac, and femoral arteries. Starting with the aortic. Renal. and there's no bruise present. I'm going to percuss her abdomen for tympani. Do you feel any pain when I'm doing this?
No.
And next I'm going to percuss the liver at the mid-clavicular line. And I can hear dullness when I do this. I'm going to percuss your mid-clavicular line, going from resonance to dullness now. Doing that on both sides. I'm going to use light palpation to see if there's any enlarged organs. Feel any tenderness?
No.
And deep palpation for any enlarged organs or tenderness. Okay. I'm going to palpate the liver. Can you take a deep breath for me and hold it? Great. I can feel the liver. It's smooth, it's firm, and it's non-tender. And then I'm going to palpate the spleen. I'm going to have you take a deep breath. Great. And I cannot feel the spleen, and this is normal. I'm going to assess her right and left kidney. I'm going to place one hand on her flank and the other on the costal margin. I want you to take a deep breath. And again. And then I'm going to palpate the aorta. I'm looking for any aortic pulsations. All right. And next, Kate, can I have you lay on the bed for me and with your feet dangling on the floor? I'm checking her lower extremities. Her hair is evenly distributed on both sides. I'm looking for any lesions. There's none present. I'm going to palpate for temperature, looking for any edema, and there's none present. Now I'm going to check her dorsalis pedis and tibial pulses. And those are both present, and they're 2+ bilaterally. Next, I'm going to check her reflexes with the reflex hammer. I'm going to check her brachial and her popliteal and her Achilles tendon. And her reflexes are present and equal on both sides. Next, I'm going to have Kate step off the bed. I'm checking her muscular strength. And that appears to be equal on both sides. I'm going to have her bent over for me. I'm looking at her cervical spine and that there's no scoliosis present. Her lumbar spine is well curved. And this concludes my assessment. Thank you very much.